Welcome everybody to another episode of The Art of Mindful Medicine. And today I have another very special guest, Dr. Rosemarie Rutecki. So it is my pleasure to introduce you to her. And Dr. Rutecki is a pharmacist with a passion for health and wellness. With a Doctor of Pharmacy degree and certification in functional medicine from the Institute of Functional Medicine, Dr. Rutecki is dedicated to uncovering the root cause of imbalances in your body. Her approach to care goes beyond the surface symptoms and delves into the complex interplay of nutrition, digestion, detoxification, immune function, hormones, and metabolism. Lots of stuff going on. So by analyzing these critical areas, Dr. Rutecki empowers her clients to achieve optimal health and peak performance. She looks forward to working together to create a healthier version of you. So, Rosemarie, thank you so much for being with us today. Really appreciate you coming on here. And as always, I always love to start with gratitude. So could you please share with us 3 things you're grateful for today?
Today, well, thank you so much for having me in your podcast and all the people that are taking their time to listen to us. I'm very grateful for that. I'm grateful for my children. That's what drives me to move every day. Very grateful for my health, that I can, I'm able to walk, to do things for myself, to have energy. That's what so many people wish to have right now. I have it. And also that I have a roof, a place to live. I have food on my table. So many things to be grateful for right now.
Mm-hmm. And as we're going to learn, it's not just any food. So
Yes.
that's a big part of it, right? So one of the things that I love, and it really, I've been inspired to do this for others, but I also get inspired by others doing it themselves, is empowering others.
Yes.
And that's one of the things that you said that you're passionate about. So I want to start off a little bit about you kind of before medicine. What did your journey look like? How did you kind of turn into the woman that you are now?
Well, I started, my family, they used to have a pharmacy in Puerto Rico. I am from Puerto Rico. So we have always been the type of people that want to serve others. So when you're a business owner and, work on healthcare at the same time, you have that passion to serve others, the community, and it was a community store. So everybody from the neighborhood will come and we will have coffee together. We'll talk about, always try to help them. So since little, I was very inspired into help others. So I studied pharmacy, and then I went from Puerto Rico, I moved to Chicago to finish my doctorate degree. And then I did my residency. And then I fell in love and I stayed in Chicago with my now husband. So the plans changed. I was supposed to go back home. So then I started working on the traditional, pharmacies. They're very different from a community pharmacy. It's more like volume and, prescriptions. There was not too much care. And that kind of made me feel very sad about the profession, because I'm like, this is not what I thought it was going to be. And then you learn that people don't get better just giving them medications. I mean, if you have an infection and you take an antibiotic, that's going to save your life. Of course, medications have their place. But for chronic conditions, it's just one medication on top of the other. And then I felt that I was not fulfilling what I wanted to do, which was really helping people to heal. So that's when everything started. Then I started having my own health issues, have developed a lot of fatigue. I developed a lot of digestive issues, hormone imbalances. I would drive and I would fall asleep driving. And then, of course, you go to the doctor and get your lab work done, check everything. Everything came back normal. And they said, well, it's part of perimenopause. And I'm like, I can't be in perimenopause in my 30s. There's something wrong with me. But the traditional lab work was not telling the answers. So I looking for answers. I found functional medicine, and here I am today because I learned so much and I was able to improve my health that I'm like, people need to know about this because there's so many people right now living in a state of fatigue and digestive issues and hormone issues and overall just not feeling at their full potential. So we need to get this information out of people. We can get better. We can have energy. We can heal. We just have to put the right things in and take the bad stuff out.
For sure. And that's how you restore function, right? And one of the other things that I've noticed is the depressive state that people can be in from all of these conditions, and it's from all the actual causes that create those feelings that you were talking about. It's like a double whammy, right? Like it causes those things, but it also causes that depression, and like the cure, quote unquote, for all of that is really the same thing. And kind of one of the things we're going to really dive into today. But I want to stay on you first and your journey. And I'm curious the kind of lessons that you learned along that healing journey for yourself. What were some of the realizations that you had?
I learned to be very disciplined and consistent, and that healing is not fast, right? We are so used to get like a quick a response, right? We want results right away with the minimum amount of effort. We're looking for a quick fix. So when you're healing yourself from, let's say, years of dysfunction, right? Years of eating really bad, years of traumatic stress, heavy metals, toxins in your bodies, issues with your oral health, right? It's going to take time to heal. So that's one of the biggest realization. And that this is not a quick fix, it's a lifestyle. We have to embody. If we want to be healthy, we have to practice that. We have to work on our, nutrition. We got to exercise. We got to meditate, because stress right now is at the highest, right? There's so many, we watch social media, we get bombarded with bad news. And we also have to work in centering ourselves, finding peace. And, I learn all that as I go, right? The more you also see clients, doesn't matter how many supplements you take, how much exercise, or maybe how wonderful is your nutrition. If you're not also addressing the stress, your relationship, the people that you're with, right? It's a whole, we are a whole being, our environment, and we're spending enough time outside. Right? Are we in the sun? Are we experiencing joy on a daily basis? So it's much more than just, give me a supplement and I'm going to be fine, right? That's one of the biggest lessons. And I keep learning every day, right? We could choose to be in a state of suffering, or we can choose to be on a state of feeling good. And for that, we have to work like anybody does, right? If you have a business, you have to work really hard for your business to make it, be successful, because the first year that someone opened a business, it can just, you cannot do good. The same thing with your relationships, right? If you want a good relationship with your kids, with your husband, with your parents, you have to invest time on it. You have to work on it. So that has been the biggest lesson for me. And I like to teach that to my clients, that they have to continue to work and be consistent, disciplined, and persistent for the things that they really want in life.
Yeah, it's interesting because, it's funny that you're a pharmacist, and it's like we rely on the external pharmacy to kind of regulate our states and our conditions and our emotions and all these different things. But all the things you just mentioned, really what they do is balance the internal pharmacy. Mm-hmm. And when the internal pharmacy is balanced, we're divine beings. We know how to, our body just knows how to operate if we put it in the right conditions. Yes. So I love that. It's really important to hear that, because your journey, my journey, other people's journey, they're all different, but they have these points of connection that we can all kind of relate to and see. It's like, oh, I've felt that. I've been there. I can understand that. So thank you for that. So I understand kind of what got you into pharmacy. That was a family thing, and you alluded to it a little bit. What is your current views, I guess, on the pharmaceutical industry?
Well, unfortunately, the pharmaceutical industry is all about profit. They're not about, the people, right? Because the one medication gives you side effects and you need to have another one. So when I was practicing pharmacy in the hospitals, I practiced everywhere. I did a residency in a hospital, so I worked in hospital for a year. I did ambulatory care. I did the retail stores. I did insurance. I did, I saw everything in pharmacy. And the goal is to, more medications and, just checking that your you have, if you're diabetic, you should be in 6, 7 prescription drugs, right? Because we got to protect your liver, we got to protect your kidneys, we got to protect your sugars, your blood pressure, your heart, your cholesterol, right? And then all these medications have tons of side effects. And the thing is that we don't have studies, checking all these medications at the same time. When they do studies, it's with one drug and then the population. It's not like 10 drugs for a specific. So, and it's not a quality of life. Who wants to live with, 10 prescription medications and then you have 10 and then you still feel like crap and then they ask you, okay, well, let's give you something for depression and anxiety, right? So it's a great business model, right? Because if the more people are sick, the more money you're gonna take. They have to renew their prescription model, right? It's kind of like a subscription model that never ends, right? Every month you have to go to the pharmacy to continue getting those medications. And then doctors are trained, unfortunately, to prescribe, to diagnose, which we're great at that. We have to be very thankful for that. But then the only tool that they have is a prescription drug. There's nothing else in their toolbox to help patients. And most of doctors, they get like a 2 hour, maybe an hour of nutrition in their whole 4 years of training. Or if they do residencies, it's 4, 6 years more.
If at all.
Exactly. Right? So we can also blame them, but at the same, because they were not instructed that. But at the same time, those are the first people we go to, and they don't have too much to offer for us other than surgery and a prescription medication. In my opinion, it's very hard.
Yeah, I understand. It's unfortunate. I mean, thankfully, there's at least like maybe a couple, maybe hopefully a handful of medical schools that are actually integrating some nutrition stuff now. But yeah, in the past, it's been unbelievably absent. And it's funny, I want to highlight one of the things that you said, that the studies that on the drugs that are coming out from the pharmaceutical companies, yeah, they might do a study, a very particular type of study on that one drug, but they're not doing studies on the combinations of these drugs.
Exactly.
But what the other thing that people should understand is that there are side effects still, even of the one drug. It's just, it might take a really long time to manifest it, because it's a lot of times if you turn off a process in the body, it's going to have other downstream effects. And if you're not looking for those effects, and it turns into some kind of chronic condition, this isn't something you're necessarily going to see in these trials that they do for these drugs that deem them safe and effective, So that is a really important point that I'm happy you mentioned, because people really do need to understand that. And I completely agree with you that there are places and necessary uses for certain medications, because they do save people's lives. But it's just, we are certainly overutilizing these drugs.
100%. Yeah. Especially, like, just to give you an example, like medications for acid reflux, like Prilosec and things like that now are over the counter. They mess up your gut microbiome completely. And as side effects, they have found that they can increase the risk for Alzheimer's, they can increase the risk for osteoporosis. And these medications are intended to be taken for like 7 to 14 days just to target something acute, right? They're not meant to be used chronically. And what's happening right now, people are taking these medications for years, right? We are not fixing the issue, and then we're making them more sick. Then they're gonna end up with osteoporosis, they're gonna end up with dementia, Alzheimer's, and that's great for the prescription pharma medical model, right? Like, we just keep making people more sick and sick. So it's a great business, but it's hurting us.
Yeah, it really is. And so functional medicine, when did that come into the picture for you? How did you discover it? And I think I understand a little bit of your inspiration to pursue it, but can you tell us a little bit about how that happened?
So this is one of the reasons why I am so blessed to have children. So when my son was born, I think she was like around 2.5. For her, was very traumatic when my son was born, right? And then she stopped talking. She stopped talking in school, and she stopped talking to strangers. And then we thought that was a phase. that it was going to go away, right? I took her to the doctor and she's like, don't worry, that's a phase. It's normal. Sometimes kids go through that. And I'm like, okay, that phase lasted a year. And I'm like, it was affecting her school because she was not verbalizing at school. She was interacting, smiling, having fun, but she was not talking. So I discovered that she has something called selective mutism at that age. And that's an anxiety disorder that affects kids to the point that they are so scared that they cannot talk to strangers. They can only talk to their families and people that they know. So when I discovered that, that was very sad, right? Because a lot of these kids, they grew up as adults and they can't get out of the house. They're pretty much at their homes. They work in the computers. They don't have any social life. And as a parent, you don't want that for your child. You want your child to be able to go out, enjoy life, do great things. And I knew, and she's such a vibrant, at that time, vibrant girl, so, so funny, always, talking and playing. And then she would just close up when people would come and then she would shut down. So we did a lot of cognitive behavioral therapy with her. I took a lot of seminars. I learned a lot about it. And then in 1 month, she started talking, right? So it's possible to fix that. Right. So I learned that. So I'm the type of person that I look for the solution. I was not, when I went to the conference, there were parents with teenagers crying. Like, my kid can go and she couldn't go to a plane with me. My kid can get out of the house. And when I saw that suffering in the parents, I'm like, I have to help my daughter. Right. So when she finally started talking, I started looking for the root cause, like why she had that. Right. Because it's not, usually a parent will have a lot of anxiety or went through that as a child. And that didn't happen with us. So I started learning about genes, right? And then I started learning about MTHFR. And then I discovered that she had that mutation. She had actually 2 SNPs of that. And that's related to anxiety. So I was trying to look, if that's an anxiety disorder, what is causing the anxiety in the first place? And then I found about the genes. And then finding about the genes, I found this doctor that she specialized on MTHFR and functional medicine. So that's how I discovered functional medicine, because even though she started talking, I wanted to prevent that from coming back again and really nail it, right? Because it was very, hard to see her, going through that. And then I didn't want her to, in the future for that to come again. So that's how I discovered functional medicine. That's the story.
For sure. Yeah. Thank you. Wow. That is quite the journey. And which kind of brings me into the next topic. I'm sure that took a lot of understanding and patience and mindfulness.
Yes.
So my first question to you on that topic is, what does mindfulness mean to you?
Mindfulness means to me to be in the present moment and enjoying, everything that you have right now. We live in such a fast space that we are just not paying attention of what we have right now, right? And that we are so fearful of the future. And we are so still, thinking about what happened in the past, right? And I want to live a life where I have the right now, and the choices that I make now will give me a better future, but not being afraid of what's coming because it's not here yet, right? Exactly. So that's mindfulness for me, just savoring the day, waking up every morning. We have a ritual with me and the kids. We wake up and we yell, "Today's a great day," right? We prime our day just from the beginning that it's going to be a great day. So awesome. That, to me, is what mindfulness is.
I love that. That's a great little exercise in the morning to do. So what are some other ways that you personally practice mindfulness?
I like to meditate in the mornings and before I go to bed. I like doing some mindfulness meditation and also some mindfulness walking outside when I'm in the yard. Like, I take my shoes off and I like to feel my feet in the grass, grounding with earth. I like feeling the sun on my face. I love listening to the birds in the morning. Just little things, right? Just understanding that we have to be so connected with our earth and environment. And one of the reasons why we're so sick is because we are behind walls. we're with artificial light, we're in the computer all the time. So I like to take moments of gratitude, breathing the air, being outside, and enjoying the greatness of Earth.
Yeah, I agree with all of that. For me, it comes back to the paramount point is that it creates balance within, and that's going to be one of the major things that we talk about in a few minutes. But that balance is guided by our actions, so to speak, in that those mindfulness kind of practices that you were talking about. So what kind of differences have you noticed in yourself from prior to utilizing these practices to how you are now?
Well, before, I think I was like all over the place, right? Like not very fearful of doing things, and not enjoying the moment, right? Before, it was more of like a worry or what's going to happen, or worrying about what people's going to think. Now I'm more into just in this state of gratitude and enjoying everything that I have, because we have so much and sometimes we don't know how much we have, right? It's just being aware of everything that we have around us.
Yeah, that level of awareness is definitely something that I've noticed has exponentially increased in my life. So, and as far as health, for yourself, for your clients, what have you noticed? Like, how have you noticed mindful practices impacting health?
It impacts health when you know the things that you're doing, right? Because when you are not mindful, you might be eating, not connecting the dots, right? That's why I tell people, like, when we start this process of working with me, your body's going to give you signals, and the body gives you signals all the time. The thing is that we're not listening, right? We get belly ache, and then we can't connect it to all the processed food that we're eating, right? And then we go, or we say like, oh, I'm going to go eat out. I'm just going to take a medication because then that way my belly's not going to hurt. Well, how about if you modify your nutrition and then you don't have to take the medication, and then right? You don't have to. So it's that level of mindfulness that I teach people, like, listen to your body. How is your sleep being affected by the things that you're doing during the day? Are you watching too much news before going to bed? Are you scrolling on the phone? Is that what's affecting your sleep, right? Sometimes it's just things that we do normally during the day, and that's what's causing the issues on the first place, right? Not having meaningful relationships. Maybe people just live a life that is just, a type of work, they don't have meaning in their relationship. So of course, you're going to feel empty if you're not really caring for others or for your family. So those are the things that I like to bring to people, being mindful for what they do, what they put in their bodies, what they eat, the words that come out of them, their thoughts too, because our thoughts are very important, because we are our worst enemies. If we're thinking negatively all the time, or that that we're not deserving, that we're not pretty enough, that nothing good happens to me, guess what? That's what the brain is going to register, and that's exactly what's going to happen to you. So we have to be on a state of really aware of our thoughts, what we do, how much movement we're putting into our body, and then just listening for signs.
Yeah, no, totally agree. And we've been talking about this term functional medicine. So what is functional medicine? And for people that don't know, how is it different from allopathic or conventional medicine practices?
So functional medicine focuses in looking for the root cause of the disease, and usually conventional medicine, what is more focusing is in the problem that you have, and then, diagnose and prescription. And then you're sent off home. You see the doctor for 15, 20 minutes the most. And then you're lucky if you can get a follow-up a couple months later, right? To see if they need to bump your dose of the medication, or they need to start you in the medication. Or sometimes people go to the doctors and they come to me and say, well, the doctor, I'm not already have a diagnosis of hypothyroidism, but they say to wait, maybe in a couple of months, I will have the diagnosis, right? And that's like the most horrible thing, right? Because what it's telling the people and all of us is like, we can't do anything for you right now, But when you get worse, then we can prescribe you something. As of right now, I can't do anything for you, right? So with functional medicine, there's so many things that we can do to prevent, to get you there in the first place. And if you're there, to help your body to get out of there, right? Because we have made so many advancements right now in science that we can even age, slow down our aging process. So chronologically, you might be 50, 40 years old, but biologically you could be 20, right? If you do the right things. So that's what I tell my clients too. So the body has the capacity of healing. The body has the capacity to age slower, but we have to do the work and we have to put the right things in, right? So that's the biggest difference between conventional and functional medicine. Functional medicine also looks everything into a whole system. So it's a system-based approach. So if not that you come to the doctor, just to the endocrinologist to fix your sugars, but then you have to go to the nephrologist to check the side effects of the medication that you took for your sugars to see that your kidneys are working, right? So people are sometimes seeing 5, 6 specialists. And when they come to me, they're like, oh, I saw a rheumatologist, endocrinologist, and it's like a whole list. And they haven't been able to find everything is fine, but I feel terrible, right? And that's when the approach of seeing the body as a whole thing, right? Everything starts changing. People start, getting better, and all those things go away. So I have people that come with autoimmune conditions, and then they leave new without medications or anything, right? An autoimmune condition is something that I would not say that you can cure, right? Because that's the way that you have it. You can go in remission and also get better and stop the progression. But we have to be aware of people saying, I cure this, I cure that, right? The body heals, and it does the work by itself when we put the right things in. So that's what functional medicine is.
Yeah, thank you. The concept you mentioned about the aging is one that's really interesting. It's this newer concept of the biological age versus chronological age, and actually like aging backwards in a sense.
Exactly.
And this concept of escape velocity, and that some professionals have been talking about, is really interesting. So I'm kind of excited to hear and continue to watch how that front goes, because apparently a lot of scientists think we might get there in the next decade, which is pretty fascinating. So we'll see how that goes. So diving in a little bit more to functional medicine, and I know this is one of the core features of what we both do, and that is gut health. So why is gut health important for overall health?
So gut health is my favorite thing right now, right? And having a gut-centric approach is the way that I live my life, the way that we eat here at home, and the way that I teach all my clients. There's so many health conditions related to your gut. So for example, autoimmune conditions, cancer, eczema, cardiovascular disease, diabetes, mental disorders, of course, gut issues, Crohn's, colitis, constipation, diarrhea. All these conditions start in the gut, right? And this is what I teach my patients, very simple so everybody can understand. When the gut is not happy, it's going to let us know. And the way it's going to let us know is by getting sick. And I tell you, some people are going to get cancer. Some people are going to have autoimmune conditions. Some people are going to get a gut issue. Some people are going to get depression and anxiety, right? Because there's the connection between the gut and the brain, and the brain and the gut. So if we want to have, and we want to cover all the bases, we need to have the boss happy. And then we have to feed them. I feed every day. The way I eat is to feed my gut, because I know if he's happy, I'm going to be good. I'm going to have energy. When I started eating for the gut, my constipation went away, my fatigue went away, my hormones got balanced. I stopped having cramps. I thought that it was normal to have menstrual cramps and be miserable, because that's what they taught us, right? Like, you're a female, you're going to have a period, you need to take tons of drugs and lay down. That was my past. And when I fixed all that, I was like, wow, I don't have any more issues. I don't have any more cramps. I don't have any more breast tenderness. I can go to the bathroom. I'm not constipated, right? All that by working in the gut. And the gut is all these microorganisms that we have, right? The gut microbiome, that it's all our bacteria. We have friendly bacteria. We have normal levels of yeast, we have normal levels of viruses. All those things, they coexist in our gut very happily. The problem is when they get disturbed, either if we take an antibiotic, we're in a lot of stress, we're eating a lot of processed food, then that's when the imbalance start coming. And you might be having a gut microbiome issue and not be presenting a gut issue per se, right? Some people are like, oh, my gut is fine. I don't need to check my gut microbiome. Then when I check their gut microbiome, they have bacteria that is related to autoimmune conditions. So that's where their autoimmune condition is coming from. So yeah, we need to work in our gut, and that a gut-centric approach, of course, exercising and all the other stuff. But if we feed our gut, we're going to see great health.
I completely agree. The gut health for me is always a focus in my personal life and at work. And you mentioned the microbiome. And you mentioned, you briefly touched on what it is, but can you dive a little bit deeper as to like what exactly the microbiome is and why this is so important?
So the microbiome is, as I said, it's like a collection of all these organisms that we have that they live inside of us. I just want to say it in like a simple way. And then when they are, another thing I wanted to add, your gut microbiome starts in your mouth, right? That's why for the people out there, Dr. Seth is my functional dentist. That's how we met. And I value so much oral health because I value my gut health. I know that I have to have great oral health because that's where your microbiome starts. So that process of the saliva, your oral microbiome, there's health conditions that are also being connected to poor, oral health, like cardiovascular disease, even cancers and things like that can start from your mouth. So, and what happened in your mouth can affect your gut and vice versa. They're all communicating because it's all, it's all connected. So definitely working on the gut in that, all those organisms, right? It's like 300 million or billions, like tons that we have, right? All these bacteria, all colonies of bacteria that live inside of us, that they need to be balanced and happy. That's pretty much what's the gut microbiome.
Yeah. So you mentioned some of the conditions that are often linked to an imbalanced gut microbiome, but those conditions are really downstream. Like once someone has cancer, if someone has tumors or an autoimmune disorder, like it can be a real challenge to come back or reverse those things. And a lot of times that can really psychologically, even if someone isn't depressed or anything, that can really be hard on some people. But what are some of the early signs and symptoms of an unhealthy gut microbiome?
Early signs and symptoms that you can tell, it will be if you're having gas, bloating, constipation, diarrhea. Those are like an early signs. Pain, reflux. Other early signs could be getting up fatigue, all of the sudden being very fatigued. That could be connected. And also feeling tired, feeling anxious or depressed. So there's a big connection, as I said before, between your gut and your brain. And I have clients that have come to me with panic attack, anxiety, depression. And sometimes, I question the power of working on the gut microbiome. I think I'm like, am I going to be able to help this person with their, with the anxiety and the panic attacks, right? Because sometimes I see patients like they come really, really bad shape. And I'm like, and then I tell to myself, trust the process, right? Trust the process. And when we start working on the gut, it's so beautiful to see the transformation in people, right? They start being happy again. They are having joy. They don't have any more panic attacks. They're no more anxious, no more depressed. And if psychologists and psychiatrists will be taught the connection between the gut and the brain and functional medicine, we will not be over medicating people with medications that has as a side effects, suicidal thoughts and all these things that can happen, right? We could be really helping people to be anxiety-free, depression-free by just working in the gut. So those are like the early things that we can see. Late stuff that we can see when there's gut microbiome dysfunction is Parkinson. So Parkinson disease is a condition that starts in the gut. So the person can start having constipation 10 years before developing Parkinson's or any other neurological disorder. So that's like something that you can detect and be proactive and work with it.
Yeah, that's one thing that I really stress with people is that how important the bugs in our gut really are, because it's not just that they assist our cells in being healthy. They actually also secrete certain like enzymes and neurotransmitters and things like that that actually promote either health or disease, depending on what the bacteria is. So it's really something special and fascinating to get a better understanding of. And the psychological aspect is another huge issue, because psychological disorders have really been on the rise. If you look at the past few decades, they've just kind of skyrocketed. And there's this really cool, fascinating new field, I guess, called nutritional psychology. And there's a doctor, I believe she's from Harvard, Dr. Uma Nadu, and she wrote a book about this. And it's really fascinating. So I definitely would direct people to that book, because she really does a great job of like talking about the foods and how certain foods help with certain aspects of depression or anxiety and all these different things. And it's really, really cool. So we're talking about microbiome, what it is, what can happen if you have an imbalanced or an unhealthy microbiome. But what are some of the causes of an unhealthy or imbalanced microbiome?
The causes of an unhealthy microbiome could be the way that you're eating, right? Not giving enough fiber, fermented foods, probiotics, prebiotics to the gut, because that's what the gut needs to be healthy. So all the gut bugs, they take food and they convert it into short-chain fatty acids, and that's the fuel, that's the energy for your colonocytes, for your colon, for your intestine to work. I compare it to, so if you buy a Ferrari, what type of gas you're gonna put on it, right? Are you gonna put the cheaper one, or are you gonna put premium? You're gonna put premium, right? Because if you put the wrong one, the car is going to be messed up. So the same happened to us. And when we understand that if we start treating our bodies as a Ferrari, and for our motor needs, which is the gut microbiome, we're going to thrive, right? And another thing that I wanted to mention is like 80% of your immune system is in your gut. This should be like mainstream media, right? Because the studies show, when we were going through the pandemic, that people that have the more microbiome diversity, more bifidobacterium, eating better and whatever, they were having better chances of survival and also getting better, not getting all the long haul and all the things that people are still suffering. And if we were focusing on the gut on the first place, right, probably less people will have died. But we are not talking about it, right? We're not talking about our immune system. And that's another early sign of someone that has gut dysfunction. Are you getting sick all the time, right? Are you sad or depressed all the time? Are you having some skin issues, eczema, dermatitis? That's very common too. So when I see people that have skin disorders, I think, okay, that could be the gut. It could be other things too, like toxins, heavy metals and things like that. But there's a big connection with the gut that we have to think right away.
Yeah, it's a really good point that you bring up the immune system being predominantly in the gut or surrounding the gut, because other than our skin, our gut from the mouth to the other end is the organ in our body that interacts with the outside world the most, which is why our immune system is so surrounding that part of our body. So it's really important for people to understand how important gut health is for our immune health. 100%. It's such an important point. So thank you for bringing that up. So you touched on this a little bit when we were talking about pharmaceutical drugs, but I want people to get a little bit of a better understanding from a pharmacist.
Yes.
Like you mentioned antibiotics, you mentioned antacids, like how do they actually affect the gut microbiome?
So the antibiotics, they are going to kill the good bacteria and the bad bacteria, right? So they're great because, if you have an infection, you want to get rid of all the bacteria that is potentially can harm you and kill you. But the problem is that they wipe up the good ones, right? And then a lot of people, after they get antibiotics, especially females, they start having a lot of yeast infections. And that's because Candida lives inside of us. It's part of the ecosystem. But when we kill all the good bacteria, then Candida becomes the queen, right? As I tell everyone, she's free now to grow because no, the other ones are not there to keep her in check. So then we having more yeast in our health, right? Where there's got some yeast issues. A lot of people that have skin disorders like eczema, psoriasis, dermatitis is related to high levels of yeast in the body. And I'm sure you see a lot of yeast in the mouth, in the oral cavity. That's an imbalance in the gut microbiome. So that's the problem with the antibiotics. And it could take 2 years to repopulate the gut after you take antibiotics. So they have done studies. Some studies show that it takes 6 years. For some people, it takes 2 years. So I tell people, unless it's like super necessary, don't take an antibiotic, because sometimes they prescribe antibiotics for viral things. Yeah. But yeah, and that's, I grew up like that. I remember when I was a child, that's why I had so many gut issues later on, because I remember being sick all the time and having antibiotic every month, right? For little things that probably the body will be able to resolve by itself. So unless it's not necessary, I would tell people to try to find other ways, like in boosting the immune system, eating healthier, taking vitamins, supplements to boost the immune system so the body can do its job. The problem with the antacids is that they decrease the stomach acidity. And the role of the stomach acidity is to prevent pathogens and overgrowth of bacteria on the first place. And a lot of people that have acid reflux, it could be because they don't have enough acid in the stomach, and that create a rebound and then rapidly production in acid. And then they take this antacid and it's not solving the issue, right? So if we want to digest the food, if we want to absorb the nutrients, and if we want to protect, the stomach is the barrier to protect our system, right? That's why the pH is very low, very acidic, to protect us. And if we increase that pH, if we make it very basic, that's when we're going to start having issues, because that barrier of protection is pretty much open. Everybody can go in, right? We don't have the army guarding our stomach. Now the doors are open, the pH is dysregulated, and I'm like, okay, parasites come in, bacteria come in from food that we eat, right? We can drink contaminated water, we can go eat, we can kiss someone that is sick, and now we have the doors open to everything to come in and create chaos. So that's what I don't like, those two medications.
Yeah, and I'm right there with you. I mean, that's why I asked, because they're extremely popular and very overused. And I mean, like you said before, the antacids, they're just over the counter now. So I mean, you can just go get them whenever you want, which is, I think, it was a horrible decision. But thank you for kind of or diving a little bit deeper into that, because it's really important for people to understand that these things, like, unless you absolutely need it,
exactly,
they're just there are other ways to kind of mediate these problems.
Yeah.
So we've been talking about the microbiome, and we're talking a lot of what we've been talking about is imbalances and what an unhealthy microbiome looks like. So are we able to alter the microbiome and create balance? And like, how long can something like that take
to improve it?
Yeah.
Well, studies have shown between 6 months to a year to improve back your gut microbiome. And that's usually what I see, with people, like when they start, it takes time to get the growth back. And then I tell people the best way to improve your gut microbiome is through food, through fermented foods, through tons of fiber, because you are creating the environment, you're regenerating it again. Probiotics have their place, right? They're useful, but they're placeholders. They're just going to be there for the time that they are, and then they're gone. The best way to keep that growth of the good guys again, remember, it's like the antibiotic came and destroyed our army, right? So now we have to bring it back again. And we bring it back with tons of good food. And also, stress is a big one that change our gut microbiome too. It creates leaky gut and tons of other issues. So if we want to improve our gut, we also have to work on different areas, not just the food, the fermented foods, also exercising, meditating, working on relationships. So our gut is it's a very sensitive one. Needs a lot of attention.
It does. It does. But I mean, it's things that I mean, like sleep is another thing. Like, and you mentioned like
Sleep.
getting out in nature. Like,
Yep.
these are things that they're just they're natural for us to be doing in
That
the
we're
first place.
supposed to be doing in the first place. Exactly. Yep.
So it's like going back home in a sense,
Exactly.
you know.
Going back to basics. That's what I tell people. And it's like, I tell them, this might sound silly. This might be what you were thinking we were going to be doing, but you got to work on the basics. And that's how you're going to get better.
Yeah. Yeah. So, yeah, I mean, we could talk about that all day, but the biggest thing that I know you focus on, you just mentioned it, and that I talk to people a lot about is food. And I've heard countless stories of whether it's a cancer survivor or someone that has high blood pressure or just had heart surgery or something, and the people, or if they have gut issues, if they've just had Crohn's disease or something, and now they're on medication or something, and then they ask the doctor, well, what can I eat? And the doctor's like, eat whatever you want.
Exactly.
And it's just, well, no, it's not exactly eat whatever you want, especially if it's directly a gut issue. Like if you have irritable bowel or something like that, I mean, what you eat is, I mean, just ask somebody with irritable bowel if what they eat affects what's going on with their gut. So which foods do you find are most problematic for the gut microbiome, and which are the most effective for improving and boosting the diversity of the gut microbiome?
So the worst one would be alcohol. That's terrible for the gut microbiome. Highly processed foods are not good. So tons of sugar, colorants. You think about all these processed foods, what they have, right? They can last years. So that's not natural, right? And then I don't blame people for not knowing this, because when I was younger, I didn't know that. You know, I was eating the traditional standard American diet. I thought that, tons of wheat was great for me because it's great for the heart and all those stuff, right? And then I discovered that I have a gluten sensitivity. And then what I thought that was like helping me to be healthy was actually making things worse. But that's kind of like in a case scenario. Tons of these oils that are like very highly processed, and they have to use chemicals to make these vegetable oils. A lot of processed food, that's what they put on it, right? And that's what our kids are eating. Kids are eating these days. The standard American diet is chicken nuggets and pasta, and it's all processed, right? You can make your own nice, healthy chicken nuggets at home. That's what I tell people, and with in a healthy version. These ones are all full of sodium and sugars and processed food, and maybe it's like a little bit of chicken, and the rest is just oils. The high corn fructose syrup is terrible too. In the canola oils, so oils are pretty good. I mean, pretty bad. The sugars are pretty bad. Alcohol is bad. Those are the ones that we need to stay away from. And then just go back to basic. Tons of fruits, tons of vegetables. And something that I want to say is like, there's a lot of diets out there, right? And I tell people, you have to find what is best for you, because we all have different microbiome diversity. For some people, a vegan diet is going to be great. For some people, a Mediterranean diet is going to be amazing, right? So you have to find what your body needs and likes and wants to receive. That's when the awareness, mindfulness approach comes, when I tell people, right? A lot of these diets have in common is that when people stop eating processed foods, it doesn't matter if they are in paleo, vegan, carnivore, whatever, what all they have in common, that they all remove the processed foods. They all remove the excess sugar. They all remove all the chemicals, food with glyphosate and all these things. And now they're eating food that is alive. And that's why the body's healing. So whatever you find is good for you, great, but take the processed foods out.
For sure. Yeah. I mean, that was great. You actually beat me to one of my last few questions. That's perfect, because it's really important for people to realize that it's not like this is the best diet. This is the best diet. For like, the best diet is the one that works for you, because what works for me is not necessarily going to work for you.
100%.
And like you really well pointed out, was what's common amongst all of them is, like you said, the processed foods, like the refined sugars, the refined carbohydrates, things like that. You've removed those things. That's like probably more than half of the battle right there.
Exactly. Yeah. Yeah. I have people that when they come to me, they have a lot of issues, and that's the first thing that I do. We remove the initial suspects, right? Which is for some people, and these are usually inflammatory foods. We take out peanuts, we take out soy, we take out processed dairy, we take out gluten, right? Because a lot of people have a lot of gluten sensitivities. And it's not that gluten is bad. The problem is that if you have leaky gut, that protein is going to, the body is going to be like, what is this, right? That protein is going to go to your gut, right? And it's going to come out through the membranes because your gut is leaky. And that protein is going to either go to different organs. For some people, it can go to the thyroid and stay there. And then the body start attacking the thyroid, right? And that's a start of an autoimmune condition. For some people, it goes to the gut, that protein, that gluten protein, and the body starts attacking the intestines, and you get a colitis and a Crohn's disease. Mm-hmm. That protein is going to go to the knee. It's going to attack the knee. What's going to happen? Rheumatoid arthritis, right? And that's what I like to take that out and test for, how there's tests that we can do, like through the gut microbiome, that we can see if your body mounts an immune response to gluten. But at the beginning, I like to take people out of the suspects. Like, we're gonna, for a while, right? Because you can tell people that you want to take them from everything. They're like, oh my God, life is miserable, right? We have to do it on phases, and then just introduce things back again, and then let your body decide, right?
For sure. Yeah, no, that's a very powerful methodology. And that was another topic I wanted you to go into a little bit about leaky gut. And you kind of said what the effects of it are, but can you go a little bit deeper into what leaky gut actually is?
So leaky gut is when the membranes or your intestine becomes more permeable. They're usually permeable because that's the way that vitamins and minerals and all that cross through the membranes to our blood system, and we absorb all the nutrients. The problem is that when they open up too much for pathogens or bacteria that we have, or viruses that are supposed to stay in the gut, now they go to the circulation. Food that is supposed to stay in the gut, now it goes to the circulation. And then the body is going to detect those as intruders, and it's going to mount an immune response, and it's going to attack. That's going to increase the inflammation in the body, that increase disease, right? So that's why people say, and the science and all that, everything starts from the gut. And that's the way it goes, right? You have leaky gut, everything comes out, the body starts attacking, we get inflamed, we get sick, right?
Exactly. Yeah, I mean, that was a really good point that you made, that, and it doesn't affect everybody the same way, right? When you have that leaky gut, that inflammation, I kind of talk about COVID this way too, is that whatever your susceptibilities are is what that's kind of going to go to. Whether it's a neurological thing, if it's a cardiovascular thing, if it's a joint thing, not everybody. That's why nobody knows what a cure for an autoimmune disease is, right? Because it's just your immune system overreacting to whatever you're most susceptible to. And yes, leaky gut is a huge cause of that. And I appreciate how you explained it. One of the ways I do it is, like, people can think of like the inside of our gut, because we have these like little finger projections on our gut, right? Mm-hmm. And these when the fingers are tight together, it's like these tight junctions. And when there's that inflammation and the imbalanced bacteria in the gut, the junctions become a little loose.
Yes.
And that's what you were talking about, how when those junctions are loose, even whole food particles can actually travel through those loosened junctions. And that's when the body of the immune system is like, hey, what is this? This is not part of us. We need to mount an immune response. And it's not like this, it just stays right there. It can get into your bloodstream, which is exactly what you were saying. So it's really important. Go ahead.
Yeah, and then when that happens, since that's what I tell people, you don't want to have leaky gut, because that's going to decrease your immune system. So your immune system is surveillance and protecting you from big things, right? Not to be worried about the apple that you ate or the bread that you ate, right? You want your soldiers to be taking care of the big stuff, right? Not to be busy dealing with the things that you're eating. So that's another big reason to protect your gut lining, right? With eating the right foods, lowering the stress, decreasing the cortisol. Cortisol is a big one, causing leaky gut. And then working with a functional medicine practitioner that if you are very stressed, or either you took an antibiotic or you're going to take an antibiotic, there's things that can be done to, help decrease the side effects and protect you. It's not that everything is, I'm stressed out, I have high cortisol, there's nothing good for me. There's things that we can do because we're all stressed. So there's ways that we can protect our body.
For sure. And that's another important point is stress, that we all have these stressors in our lives, but it's just how we deal with them. Exactly. And the amount of awareness that we create around these factors in our lives.
Yes.
So you did talk about a little bit about oral health before, but I'm curious in your, obviously that's what I do, so I see it all the time.
Yeah.
But in your patient pool, how often do you see people that have oral health issues that are tied to gut issues or other issues in their body?
All the time. One of the first questions that I ask my clients, if they have any amalgams, if they have root canals, if they have cavitation, when was the last time that they went to the dentist? And I always refer them to a functional medicine dentist. And then I explain them what, right? Because I can be helping them a lot in a lot of other issues, but if they don't take care of the oral health, they might not feel 100%, or we might not even nail it. Maybe the root cause, as we were talking, the root cause could be different for anyone, right? And I tell people my job is to be a detective, try to find out where it's coming from, and then guide you so we can, what I can do in my work, I can fix you or refer you to a specialist like a dentist to take care of your mouth. Some people need a therapy, to talk to a therapist to deal with past traumas. A lot of people have been abused as children or go through very traumatic events. And if you don't work that, you're not going to heal, right? So the mouth is really important, working on our traumas and detoxifying. All of those things are super important.
Yeah, it's important that people realize that a lot of times an illness or a condition or whatever we're dealing with isn't just necessarily coming from one place. And we have to look at the body as a whole system rather than just these individual parts and trying to kind of just focus on one, zoom in and reduce it down to one small issue.
Exactly. And someone, I have seen patients that they have a lot of mercury amalgams and that they're complaining about brain fog, that they're forgetting things, high blood pressure. All those things are connected to mercury levels in the body. And until they don't correct that, they're going to continue to have the issues, right? Mm-hmm. That's why I like going to you, because you don't put any fluoride. Before, I used to go to a regular dentist for cleanings and checkups, and it was such a battle to tell them that I don't want fluoride. I'm fine, right? No, you need fluoride. And then it's just for me, was going to the dentist and having to get into that discussion was just taking too much of my energy, right? Because I knew that I was not going to make them change the way that they practice, and that's also not my intention. But I also want to be respected. If I say no, just respect my opinion. So being with you is just a breath of fresh air, because it's exactly, you are the functional medicine for the mouth. You are what you do for the mouth, what I do for the rest of the body.
Yeah, exactly. And it's funny you bring up fluoride. It's people. There's actually studies that link fluoride toxicity to subclinical hypothyroidism, and it's just I don't know why these things are just kind of pushed under the rug, because it's so important. Hypothyroidism. I see so many people with hypothyroidism. It's actually shocking.
Yeah, it's I see it all the time. I even have people that they have never had, that they come very tired, very fatigued, all the symptoms of hypothyroidism, and they have never had a full thyroid panel. Doctors are not doing full thyroid panel.
For sure.
It's only the TSH, right? And then, and they never also check for Hashimoto's. Why they would check for that, right? They usually check for Hashimoto's if you have a TSH that is out of range. And I have found Hashimoto's on patients that don't have any issues with the TSH. Right. So it's the early approach of functional testing we can prevent things from coming 10 years by just doing tests that will help you.
100%. And that's with just about all of these chronic conditions. It's like these things need to be dealt with 10, 15, 20 years before, when those signs and symptoms kind of start building up. So you talked about the different schools of thought about diet, and like the carnivore, vegan, vegetarian, paleo, keto, all these different schools of thought. But I find that a predominantly whole foods, plant-based diet, whatever you do, is really kind of the way to go, right? But whatever people choose that's best for them, how do you recommend people start this transition process? Because I feel like that's something that really requires a lot of coaching for some people.
Yeah, I start by, when you put nutrients and the right amount of calories into the diet to people, that helps. So I like doing personalized plans based on what they need, so they're not hungry. The problem is that why we cheat, what we process food, is because we're hungry. We're hungry, and then we don't plan and we don't know, right? We grab that bag of chips, we grab that bag of of cookies, and then we eat a salad, and that's it, right? Of course you're hungry. You're not eating enough, right? And then when people come to me, they're like, wow, I couldn't believe that I can eat this much amount of food. I'm like, yes, you can. And then people start losing weight. So I found that one of the reasons why people are eating so many processed food is because they're hungry and they're not getting the nutrients that they need. And then when you put the nutrition back into your body, you're not going to be hungry for stuff, right? And I like to make it fun for people. Like, I allow them to have like healthy sweets that they can do homemade at home, and things that are healthy, just to keep that sweet tooth, especially when you're starting something new at the first time. And then having enough amount of protein to balance the blood sugars is very important. I found that helped people control their cravings. So good balance of fat, protein, and carbohydrates is essential. Tons of fiber and tons of fermented foods. Yeah. And anyway, I love fermented foods.
Me too. It's funny, the two gut people are talking about fermented foods all the time. I love it. So what is, I'm curious, what are the sweet treat that you, or like, what's the first thing that comes to mind as like the sweet treat that you'd recommend for people as like a dessert or something like that?
I love dark chocolate.
Mm-hmm.
Dark chocolate is really good. I love honey. I love dates. I love like dry fruit, like prunes. They're high in fiber. It kind of work like you're having a cake, right? Because they bring that sweetness. And then there's recipes where they can do a banana bread, like a healthy gluten-free banana bread, or I ask them what they like, and
mm-hmm.
then I bring them something that brings them joy, because the most important thing is to keep them consistent eating with the healthy stuff, and then some rewards. And when someone is doing that, let's say for 21 days, 60 days, you start creating a habit. And then I see people that transition to, I don't need you to make me more a meal plan. I know what I need to eat, right? And
mm-hmm.
That's the beauty of it, right? I love it because you got it, right?
Yeah.
You don't need me to tell you what you need to eat for breakfast, for lunch, for dinner, for snacks. Now you got it. Now you know what you need. And then we do elimination of things, and then reintroduction. Their body decides what they can bring.
Yeah, no, that's great. So starting to wrap up, you've created something called the Rutecki Method.
Yes.
I'm curious, could you just take a minute or two to kind of explain what that is?
Yes. So when I do my one-on-one calls for people that want to work with me, a lot of people, I have a lot of people that join the program, and then I have people that they don't have the resources to join, right? Because functional medicine, unfortunately, the lab testing is the most expensive part, and the supplements and things like that. And sometimes people don't have the money to invest. And then when I hang out with those people, I felt like I want to help everyone, right? I want to make functional medicine accessible to others. So I did an online course where it's kind of like a reset, right? It's pretty much what I work with my one-on-one clients without the lab testing, right? It's more nutrition and lifestyle changes and some supplement recommendations. I give them recipes too, tons of recipes. And the idea is to lower the inflammation in the body. And it's people can, they see it on their homes, a video, they got ebooks, they have resources. So it's learning a lot about the whys, right? We talk a lot about leaky gut, what causes leaky gut. We talk about circadian rhythm, why it's so important for gut health, why it's so important for your overall health. We talk about different conditions. Some people have constipation, diarrhea, gas, bloating. Almost half of the population, I think, have like issues with their gut, right? Any type of IBS situation. So it's to guide them, to help them to reset. And that's the first step that I do with my clients. And the first 30 days, while we wait for results to come back, they're already feeling great. So that's what I want for people, to have that opportunity. If they can, maybe they're far away from a functional medicine doctor, or they don't have the resources at the time, they can get better at very affordable price.
Yeah, that's beautiful. Thank you. We're going to give people the information for that in just a minute. But my last question for you is the following. So if this were the last time you ever had to share your thoughts, and you could only share 3 things that people could start implementing into their lives immediately to improve their health, what would they be?
The number one would be to love their loved ones. That's when we have seen documentaries of the blue zones, the people that last the long is the ones that have the most supportive communities. And we live alone. We're lonely. We don't have anybody to talk to. And just having company, people that we love and good relationship, can create gut microbiome diversity, right? Mm-hmm. So we're talking about gut microbiome. Also improve your cardiovascular health, just that state of being joy. So that would be number one. Number 2, working for the gut microbiome, eating for the gut microbiome. And number 3, sleep. Because if we don't sleep, we can't function the next day. We're in this culture of people like, I sleep 4 hours, I'm great, I'm the best. I am this, worker, entrepreneur. And then years later, they're going down, right? Their health comes down. We need to sleep. Our growth hormone is released when we're sleeping. We regenerate when we're sleeping. There's so many things that happen when we sleep. So sleep is the best medicine. So joy, community, eating for the gut, and sleep. Those will be my 3 things. I have more, but those are those are the ones that I don't negotiate. Yeah, don't mess with my sleep. Don't mess with my fermented foods. And don't mess with the joy and the love of my family.
I agree. Those are 3 beautiful ones. Thank you for that. So everybody, as we're closing out here, Dr. Rutecki is on Instagram, and she's at Dr. Rosemarie_Rutecki. You also have a website that I'm going to link below, so people can get in there. And for the Rutecki Method, you're actually really, even though it is affordable, you're kind enough to offer a discount code. So there's a special discount for people that are watching this for the Rutecki Method, which is the online course that Dr. Rutecki was talking about, and it's mindful DR, the number 10.
Yes.
So that's all going to be below, and you'll get all that information down there, and then you can feel free to reach out to me, reach out to Dr. Rutecki on Instagram or via her website. And as always, I always appreciate you guys watching this and supporting me and this channel. And it's just beautiful. I get to learn and share so much, and I like hearing all the comments and feedback. So it's always welcome. I appreciate you guys for watching this episode. Click all the like and subscribe buttons. Share this episode with other people. I really would appreciate that. You can find all of the episodes, past and future, on the YouTube channel, and also on Spotify and Apple Podcasts. You can also check out my website, which is www.mindful.doctor. And I always like to end with a quote. And I think today's quote is just perfect for this conversation. And if anybody doesn't know who Michael Pollan is, you should definitely check out the Netflix docuseries that they did called Cooked. That was it's his documentary series, and it was just beautiful. I really loved it. And one of the things that he says is, eat food, not too much, mostly plants. That more or less is the short answer to the supposedly incredibly complicated and confusing question of what we humans should eat in order to be maximally healthy. And I just love it. It's like eat food, not too much, mostly plants. It just sums it all up right there, right? So anyways, Rosemarie, thank you so much for coming on here. I really appreciate your time. Everybody,
Thank
again,
you.
thank you so much for watching The Art of Mindful Medicine. And for now, that's all, folks. Peace.
Bye. Thank you so much.